Have you ever heard of this disease, hyper-aldosteronism? Well, it's a disorder that causes the adrenal gland to produce excess aldosterone. The results are devastating. Imagine living a life in which getting too angry or too excited could give you a heart attack. Well, that is the case for Joyvonne Kwamboka, a mother of 4, who is living with a medical condition that can't allow her to simply be herself and enjoy life. Raquel Mugai has more.
Thaddeus Anyuga serves his 38-year-old wife Joyvonne Kwamboka water as she slumps in one of the seats in the living room area at their home in Matasia, Kajiado County. These pain medications have become a routine for this family.
Saa zingine utasikia pain, unajua kama unasikia pain lazima sauti itatoka. Hata wewe haulali. Hata ukijaribu kuassume subconsciously it's not possible.
And as he goes ahead to take her blood pressure as usual, the reading of 174/112 is indication enough that all is not well. Normally, it should be at an optimum of 120/80 or a high of 139/89. For most people, such a high blood pressure will be as a result of certain factors like age, gender, height and most times weight. But for Kwamboka, it is none of this, a fact that startled her when it all started back in 2012.
Ninaishiwa nguvu, niko na maumivu kila wakati, ambapo kusahau vitu kwa rahisi.
The diagnosis was done in Germany in 2014. The doctors found that her body was producing too much of the hormone called aldosterone, a condition described as hyper-aldosteronism in the medical field.
Diagnosis ilikuwa imeonekana na wakaniweka kwa mashini zingine kuona ni chanzo gani kinafanya hii kemikali kumingi kwa mwili, ambapo walipata sasa kuna uvimbe kwa adrenal gland.
Aldosterone is a hormone produced in the adrenal gland, which is just above your kidneys. It normally regulates blood pressure by increasing the amount of sodium reabsorbed into the bloodstream, increasing the amount of potassium released in the urine, as well as regulating the absorption of water with sodium to increase blood volume. But Kwamboka's body produces too much of this hormone owing to a tumor in the adrenal glands. The result is a high blood pressure and low blood levels of potassium. Dr. Jaylan Mohammed, a cardiologist at the Aga Khan University Hospital, says this is a risky condition.
Potassium is really important in muscle contraction, and because the potassium levels are low, you become very weak. Your muscles generally weaken, and it can affect other electrical parts of the body like the heart and the brain, because the nervous system is also electrical.
And that Kwamboka knows well.
Saa ingine inaweza kuwa imenishika kwa miguu, siwezi move, siwezi tembea. Saa ingine inaweza kuwa imenishika hata kwa kifua, ambapo hata kupumua sasa inakuwa ni shida.
The harsh symptoms caused Kwamboka, a trained pharmacist, to leave her job, her condition affecting her family and mostly her husband, who fell into depression as he struggled with what befell them. In addition to the medication, Kwamboka has to take mandatory tests every 2 weeks, setting her back by hundreds of thousands of shillings. Kwamboka is now clinging to hope that someday she will have the tumor removed to restore her normal body function.
Tuchapata yule daktari anasema ndio mimi nimefanya hii surgery, ninaweza ifanya.
Remember, the adrenal gland itself is not the problem. It's within it is a small tumor, so you need a very experienced, careful surgeon to identify the problem. Now, it's quite possible that many people have these little pockets that appear on a CT scan or an MRI scan, but unfortunately, it doesn't mean that every single pocket that you see on the CT scan is secreting the adrenaline too high.
Kwamboka falls under the 1% of all patients in the country whose high blood pressure is caused by an underlying issue such as hyper-aldosteronism, a condition that affects more women than men in their mid-20s and mid-50s. The month of May has been designated as a National High Blood Pressure Education Month, where you will get to have your blood pressure tested. Feel free to ask questions concerning your health. Questions, some of which Kwamboka is still struggling to find answers for. Raquel Mugai, Citizen TV.